it is important that we have our health personnel take care of that for us. This session will be chaired by Mrs. Sophia Blankson. Mrs. Sophia Blankson. She says I shouldn't say anything, but I'll say it. We know the face very well at the regional hospital, but I won't say what kind of position she holds there. Oma, you are welcome. And since the Archdiocese of Cape Coast has 5 health facilities, then choosing somebody from that field to give a talk, which is on our call to promote healthcare ministry in the face of COVID-19, we have the luxury of choice and the difficulty of narrowing it down. So we had to cast the lot, and the lot fell on Dr. Francis Bentel, the medical director of Our Lady of Grace Hospital, Breman Esikuma. Dr. Bentel, please come on. Good. So, having 2 health personnel here, then my role comes to an end, and I will disappear.
Thank you very much. Akukudurufo. 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 Father, I don't know. Am I mixing or what am I supposed to do? Okay. So we are all welcome back to this afternoon's program. If you look at what is going on around us, there is the need for us, as we have gathered here, to learn about what is going on. Morokodo, especially with the COVID-19. Inti mijizi na misusude, Dr. Benton, menyana yejuma mpeni not in the hospital, but I know what he is able to do. So I accept to sit here, even as I listen to him deliver on this topic. Then at the end of the day, together we'll look at the way forward and what we can do to keep our health and be safe. Thank you very much.
Okay, thank you. Director Chair, His Grace Archbishop Emeritus, senior clergy, senior officers here, ladies and gentlemen. This audience, I think, is quite intimidating because I'm seeing my seniors here who knows even more than what I'm come to say. So that makes me a bit uncomfortable, but I'll try. Our topic this afternoon is on our call to promote healthcare ministry in the face of COVID-19. So the first question is, what is health? The health that we are going to promote, what is it? WHO defines healthcare as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So with this broad definition, now the question is, whose responsibility is healthcare? Hello? Whose responsibility is healthcare? A state of complete physical, mental, social well-being, and not merely the absence of disease or infirmity. I'm sure most of you are still thinking, and I think the answer here is, it's all of us our responsibility, or you don't agree with me? Thank you very much. Once you have agreed on that point, then I think my work now here is cut. It's made very, very, very simple. Once we agree that healthcare is our collective responsibility, then the work is about 50% complete. All of us were sitting somewhere trying to manage this big definition of healthcare. With this definition, all of you know that that means the healthcare system in Ghana is really not what it's supposed to be, but we are trying our best. So we're sitting somewhere trying to manage our healthcare. Then all of a sudden we heard December 2019 that in China, a town called Wuhan, a viral infection has started and people are dying left and right. Unfortunately, this viral infection didn't stay only in China, but now it started spreading worldwide. And by the early part of, I think, 2020, it was declared a pandemic by the World Health Organization. We've got various types of the virus. Right now, as we speak, we are battling with a variant called the Delta variant, which is more transmissible, more contagious, and more deadly. Before we proceed, let's look at some statistics. These statistics, every minute or every second, it changes because every time somebody is getting infected, somebody is dying, somebody is recovering. The last time I checked, some hours ago, worldwide, how come we are here? Where did we go wrong? Why did we oversleep? Because the capacity I think we have. Ghana is doing 1,000th of the world vaccination. Now, to look at the topic given, our call to promote healthcare, I think we all agreed from the definition that it's a shared responsibility. Or you have changed your minds? Thank you. Once we still stand by that healthcare delivery is a shared responsibility, Then we will divide this group into 4 main groups. I know there are very senior priests here, heads of departments, very big people here, market women, everybody is here. So this is a fraction of Ghana. So if you say it's a shared responsibility, that means everybody here has a role to play for us to face this COVID-19. Last year by now, I had a hospital of about 400 people. The truth is, when I stand before my people, I'll talk very boldly. But when I go back, I start crying. Yes. Because we saw death coming. But it's just by the grace of God that we are here today. God has been so gracious to Ghana. Whatever we did, your grace, I don't know. I keep on telling my people, it's just by the grace of God that we are here today. Because looking at the things that we have to do to protect ourselves, it's almost zero. Am I lying or I'm standing? I'm standing, isn't it? Thank you. Even those with the sophisticated healthcare system, people were dying. So then what about us, who are almost not there? Making 1,000 of the world vaccination, and we are still surviving. This one, medicine cannot explain. So, Your Grace, when you gave me this topic, I now give a definition for God. Anything that medicine cannot explain, that is God. Is it not true? Because by the standards, people were insulting Bill Gates' wife. This man is saying, no, but it's not her fault. They use the model. And by the model, Africans were going to die on the streets. Like what was happening in Brazil, in India. But God being so good, it didn't happen. Now you know what they are saying, because we don't have old population. Who told them that? Who told them we don't have old population? The African population, we are younger, that's why we are not dying. It's never true. It's just by the grace of God that we are here. I hope you agree with me. Yes. That notwithstanding, that doesn't mean we should leave ourselves just like that and continue to expect the grace of God. At least we have to help ourselves a bit. So the 4 main groups, we have the policymakers. Those who sit down and make the policy. This is the direction we are going. They make it and everybody follows. And that's how the system is. I'm talking about the Ministry of Health, the government. And once I'm talking to what? The religious people, the Archbishop Conference will come in. Because they want a direction where their church should go. And when they say it, it should be done. The Ghana Christian Council have what? The CHAG, they have policies that they roll out. Their job is to create the enable environment for healthcare delivery. We all know that this COVID caught everybody unawares. Nobody thought that COVID was going to come. So every country, even almighty America, was ill prepared for it. And it came. What do we do? The policymakers will roll out the policies. Though their actions to be late, they did something. By creating the enabler environment, they have to give out the PPE. They have to protect us to go to that war. Because no soldier goes to war with his own what? Weapons. When we say PPE, what is that? The mask, this common mask that we are wearing. If you wear the mask, your chance of getting the virus cuts by about 80%. This common thing alone. We need the gloves to work with. The coveralls, that thing that you see when people wear, they look like white, like they have some and that sort of thing. It's very, very expensive. At the peak of the sickness, that thing went about 500 Ghana cedis for one. And when you wear one and go in, when you come out, you have to just what? Undone and dispose it off. So assuming you have a patient lying down, you have to go to the patient 3 times a day. Just when the coveralls are 1,500 Ghana cedis. Where do we get the money from? These were the challenges we were facing. And unfortunately, some of these challenges were man-made by us sitting here. We'll get there. The policymakers will give us our medication, disinfectants, and equipment. Yes. When things were very, very bad and rough and rocky, I remember the Archbishop's Conference coming in. We thank you so much, Your Grace and your team. The government of Ghana came in, they gave out logistics. Almost every week you have to come to Cape Coast and carry them. So small with these things, we're able to what? Do something small to manage it. And now while we are reached the point of vaccination. When you get vaccinated, your chances of dying is now what? Minimal. You'll be infected all right, but you'll not die. Because when the virus comes to you, you get your bodyguards to be ready to defend you. So that's the simplest definition or explanation that I can give for vaccination. I'm sure most of you remember in those days, measles was very, very common. But now do we see them? No. I called one girl, very, very sharp girl. He's now attending Holy Child. And I said, have you seen a patient with measles before? This girl knows almost everything. Say yes. I thought you would say no. But she told me yes, he has seen some before. How many do you see? Say, I've seen one. That's a very clever girl. But in our days, measles was very, very common. It was through this vaccination program that you have what? Minimized or almost what? Eradicated it. But some of us have got some ideas or theories about vaccination. We will get there. So the work of the policymakers, government, Ministry of Health, the Archbishop Conference, through the CHAG and NCHS, they have to create an enabling environment, give us the necessary things to work with. They have done their job, and they are still doing it. Though it might not be enough, but they are doing something. Now let's look at the second group, the policy implementers. Somebody heard of the policy implementers, so I'm sure, so that one's the health workers. Me and the director, Chairman Sophia. This is what I want to disabuse all of us, our minds. When it comes to COVID fight, it's not only with the health workers. Everybody here, every Tom, Dick, and Harry, you are part of the implementing team. And what do we do? We, the implementer, what do we do? Let's look at maybe the former implementers, those who are officially supposed to do the work. Me and the Chairman, Sophia. We have to create our work passionately, respect and empathy to the sick and the family. That's why we know. We are trying our best, but at times, we have found wanting. I know that's how you tell me, so I've told you already. That is our job. We, the formal healthcare workers. By you and me sitting down, we are also part of the implementers. The clergy, you are here. Chiefs, you are here. Opinion leaders, market women, the general populace, everybody has something to do. The question is, what do we have to do? If you remember, when the lockdown came, within that day, an olunka of Gary, the price instantly doubled. Is it true of us? So if you double the price of the olunka of Gary, and we are saying that healthcare is a state of complete physical, mental, and social well-being. You are not promoting her by doing that. And as I heard one man saying, now you have increased the price of Gary, and you are believing, where are we going to get the money to buy that? So when the patient is there, now the doctor is afraid to go, the nurse is afraid to go. Because the hospital, I'm a manager of the hospital, I can't get that money to go and buy the 250. Price of mass has come down to about 7 cities, isn't it? 6 cities. Hallelujah. I said hallelujah. Amen. 250 Ghana cities at the prime, at the peak of the fight. And now the guy is now selling the mass. People are not buying. Also say, a boy and so, a boy and so. And Yambos now about pimping. Why do we do that to ourselves? Maybe the economists say, so they say what? How do you call that economist? Yaponcho. Oh, the baby, oil woman here, every day when you are hard worker, you are good, then your heart will be beating. Am I going to pick it? Am I going to die? It wasn't easy. So socially, even apart from the COVID, it wasn't healthy for us, the health workers. GPRT, what could you have done? Government did well, now space of people. Luckily, the price of petrol fell down, so much didn't change. Wash your hand before you enter the bus. That one too, police have to come and strip you. Wear masks. You say, I will not wear it unless policeman comes in. Now they say we should observe protocols. At a point, even funerals were banned. Then when the measures were lessened, they said 25 people. Was it 25 or 28? 25. Space yourself out. Your grace is that I don't even have to tell you because you know it. It's an eyesore. The weekends, the funerals, no masks, no social distance, nothing. You've forgotten that you can play a key role in that. We all have to be safe through this pandemic, but a lot depends on you and me. Government will give the policies. I'm sure the Catholic Bishop Conference came down after church. You know what? Embrace. I'm seeing the former Vicar General for a long time, for the Buble. I nearly embraced him, but because of COVID, I couldn't. Yes, leadership will give the direction, but when we don't follow it, it tends to be difficult for what? For all of us. You might be a headmaster in the school. Every school has now got a COVID team. And you'll be surprised what the teachers will say. COVID friend when you was my one for. The COVID team, the one you was my one for. It's not right. Everybody here in this pandemic is a COVID fighter. From the headmaster to the security man at the gate. Everybody. You see a student not wearing masks. Please wear your masks. But a teacher will not mind it. Forgetting that when you get the COVID and bring the classroom, you, the teacher, and your family, all of you are at risk. Am I making a point? Director Chair, what even breaks my heart most is to see we, the former health workers, the uniform ones. Don't put your head down. You know what I'm going to say, isn't it? A whole nurse walking on the street of Cape Coast, no mask. Don't you see them? Hello? What I'm saying, is it true or not? It's not nice. You see doctors walking, no mask. So what are we telling the populace? Who, excuse my language, don't understand what is going on? All of us, we are in this boat together. God, as I already said, has been graciously gracious to us. But I think we have to what? Up our game a bit. The other thing is innovation. When the COVID came, there were no coveralls. Because China, who produced the thing, there are people who are dying, they won't sell it to you. So that's why you saw the ingenuity of the Ghanaian. And I was surprised. People were sewing coveralls at a cheaper price than even the China one. Now, by God's grace, we didn't die. China opened their border, they brought their coveralls, and we've gone back to sleep. Ghana, why should we import masks from other countries when we can do it? Yes, China didn't start this yesterday. If you start this today, what time will we reach there? Ghana is an ampabia no buy shokakra on your comfortable the Americas. But what time will perfect and read there? So I think that spirit, we have to go back to it. And how can we do that? We have to encourage each other. If you see your junior with some spirit in him, push the person to be better than you. One of my professors told me, look, you people, I don't want anything from you. All that I want from you is that when I've retired, I'm in my village sitting somewhere, I heard I become some big doctor. And I will take what? Praise in that. But look like in our paradise is the other way around. There's a lot that we can do. Heads of department, headmasters, if you see somebody with the potential, push that person up. NASA, one of their topmost engineers, was my senior in secondary school 2 years ago. Olenu, a Ghanaian. If he had stayed in Ghana, would he have gone to NASA and do rockets going to space and Mars? No. Let's encourage our own, because we have a lot of things that we can do. You and me can support logistically, because as we now know, and it's so clear, the government cannot face this alone. But here, let me pray some people. When the things were bad, some colleagues in the Sukuma, one day were there when people came, get this, go and buy that, go and buy that. That spirit, the battle is not over yet, it's still there. But this week is so deadly. Our wards now are full. When you come and you are well, say, go home and what? Treat. Within a week, we had about the 10. Yes, unfortunate nurses, accountants, they are coming. And when the car said, now you see have you seen your level? You see them not wearing masks. Wear them and say, how you be able to do? Now you are there. But God being so good, they are not seriously sick, but they have tested positive. The point is, if you don't come to contact with the virus, you will not be sick. For you not to come to contact with the virus, keep the protocols. Some people will keep the protocols and still don't get it. These things we cannot explain. So it is God. Yes. I know one manager Accra. I called you, I was there when I had a call. Doctor, yes, what is it? My test is positive. My test is positive to what? Call you this man, I know you. Every time you are in mass, but you are tested positive. Let's do our part and then leave the rest for God to decide. Who will test positive, who will not test positive. This week, I think it's a bit better, maybe after the president spoke. But still, we have a long way to go. Even the break, a lot of you outside, the mask was off. Because maybe that bishop wasn't here. Maybe if you are here, they wear the mask. You don't need to wear the mask because Papa is not here. Wear it to protect your own self. And then the clergy, there's a lot that you can do for us. I know in church, in the church room, they wear the mask. But ask them, before you came to church, were you wearing the mask? Some people will be holding the mask, walking on the street. When they're about to enter, then they wear it. The virus is on the street, waiting for you to catch you. So please, let's what? Protect ourselves. The funerals, I don't know what, it looks like it's part of us, but please, we are not in normal times. Now, the third group is what? The patient. All of us here can be patient at any time. Because none of us here is immune to the virus. All of us here, we can be patient at any time. And when we become patients, all of us here too can help that same patient to get well. By giving support. Moral support, psychological support, and even financial support. Mama let's do something. By so doing, we are all trying to what? Promote it. And then there's the last group. I'm thinking maybe that's the most powerful group. The religious. All of us in this room, we are religious, isn't it? Please and please and please, remind us in your prayers every morning, every evening. Because we need that. God has been gracious to us, and I think we have to continue crying out for him to continue to be gracious upon us. Because if you have to go by science, half of us should have been gone by now. On that note, I thank you very much. Thank you.
Thank you very much, Dr. Bentel. Now, we know the roles we have to play in promoting our health care in this era of COVID-19. And the important thing he has said, thanks be to God, science has in a way been defeated. Now, we will take questions, reactions from you. Questions, comments, contributions, reactions.
Please, Doctor, my biggest issue is with the students in UCC. Because somewhere last semester, a number of the students, well, a number of them, yes, contracted this COVID, but nothing was, nothing was done. You know, they were supposed to have some isolation centers or rooms for their various halls. It wasn't created, no support, nothing. Where we have Legon going on the semester or the green and gold track just to decongest the various rooms and halls. The other universities are so congested, 8 in a room. And it's so terrible. And the numbers keep growing, but we don't hear anything coming out from the university on the research or whatever it is that they are doing. And it's a bit worrying. Thank you.
Thank you. We'll take 2 more, and then Doctor will react to them. Any other? Okay, that's one.
Hey, Dr. Mpocho, yes, I'm a task all day a mask. And no call me the mask nation oison power because into Father Catoniana, I am so. And apart from the protecting with mask and so. And then maybe you are able to prevent anything, apart from mask and so. Because I'm from a head.
Okay. The third one, let me take this and then I'll come later.
Thank you. The drugs for the vaccination, that's the first consignment came for, you understand, frontliners, including teachers. As at now, we don't know when or what is keeping the second, the coming of the second consignment. That as at now, we have not heard of it. Thank you.
Thank you. Did you use the other man?
Thank you for the questions. UCC, no isolation, no support, isn't it? And the place is congested. Yeah, that is very true. As I was speaking, I said, this whole COVID business, it caught everybody unawares. Me, heading the hospital of 400 people, every morning when you go, doctor, you want that, it's not easy. So I can imagine the regional director. And then from regional director goes to what? Director General, Minister of Health. Those people are suffering, they are sweating. If you remember one time during the peak, Director of Public Health, Your Grace, this man was, I think, standing in the air-conditioned room. I think when he was coming to break the news, they found the first case. Standing in the air-conditioned room and sweating. Do you remember that thing? Or maybe you didn't see it. The man was sweating.
the pressure on them is not easy. So yes, on paper, that's what science says we should do. But in practice, what happened at the end of the day? Did anybody die from UCC? That's what I'm saying here, God intervened for us. Because if not, when you enter some of the rooms in UCC, the room is badly stuffy. Small room, 8 people. Students, no mask. They are walking around, they are not dying. What is this? By medical standards, you should be gone, but you are not there. And unfortunately, some people say they don't want to hear that God factor. They don't want to hear what? The God factor. Maybe when we over-rely on that, we won't do anything. Yes, maybe they are coming. They are still coming. They are trying to do something, but it's not easy for them. So I think maybe under the circumstance, they are doing their best. It's not that easy. But at the end of the day, nobody died. What we are seeing that look like the virus is not so bad as science is saying. Just as we came, I read an article that the Delta variant that they said is so deadly, so transmissible. It has been with us since May. We are in July now, isn't it? So if since May, we should have started dying somewhere middle of May, and we are still not dying. This we can't explain. So yes, talk to this. And even the students, when you talk to them, they won't listen. One of the, I think, there was a coordinator for public health in each region. This man came to school. I went to a particular school. I won't like to mention the name. The headmaster has told you somebody is coming from Accra to supervise you. So instead of you like maybe dress up, you're great. That's why they wanted to show their boys. No mask, started doing whatever. The man was standing and shaking his head. Times have changed. The boys, you can't talk to them. Do this, they'll do B. So let's keep on talking. We can't stop talking. But the little that you can, please do it. And let's see what will happen. It's not easy. It's just by grace that we are here. I don't know whether I've answered your question. You take it like that, isn't it? Thank you for taking it like that. Yes. There were times you see a patient, no coverall, but I have to go and take specimen. And the lab man said, nobody will go. So to the in charge of the lab, he looked up, just one N95 marks plus a shirt and went. Because that has to be done. And somebody has to sacrifice for that. Luckily, he went and came, he didn't die. But yes, we were really exposed, but God has been with us. Supplies keep on coming, but it's sure if like we are to go strictly by those European standards, it will not be adequate. We are doing something. But everybody can do something. When you are the warden, the head principal, the whatever, let everybody under you please observe your protocol. Tell your senior housemasters, your housemasters, tell the children to what? It's not being done. It's all of us, our collective responsibility. So let's do the little that each one can do and then pray and continue praying. That's all that I can say to that. Or the chairman, you ask something to her question.
Yes. What I want to add is that, yes, there may be 8 people in a room, but how are we taking care of ourselves? When we need to put on the mask, let's put on the mask. One question, somebody asked that we are tired of the mask. Yes, we are tired. We are all tired. So when we are wearing it, we are not wearing it well. You can never tell. This type is so virulent that you will get to the signs and symptoms, but sometimes they are milder. And people are dying out of it, not knowing what it's meant to be, what is causing the death. And I hear people saying that I don't want to, especially when they are to go to Interbetin or the teaching hospital, we don't want to go. Because then when you go, they treat you as if you have COVID. They don't want to, they won't take you in, they will ask questions. Yes, we have to ask questions. Because you can never tell who has it or not. Sometimes we think that it is not COVID, but you can never tell when we have not done the investigation. When COVID came, in my hospital, we had about 800 cases, and a third of those 800 cases were health personnel. Because they were the people that you come and meet. When they are taking care of you, and they will not take care of themselves, they will not wear the mask, they do anything. So by the time you can say, Jack, a whole department, you can get everybody getting infected. Just one patient that came and was infected. So it is all our responsibility. Let's take care of ourselves. Some of them will not even bath. They will not change their dresses. They go, they walk around and come and sleep in the same dress. They wake up, they are wearing it the same day. So I think that we need to take care of our health. The personal hygiene too is very important. And before we finish everything, maybe we have forgotten about the way we must wash our hands. The way we should use the sanitizer. We will demonstrate it once again so that we remind ourselves. It is all of us, it is our responsibility. It behoves on us to take care of our own health. Whether the president says we should wear masks or not, it is your own health that we have to take care of. So let's all be mindful of that. You might be tired of wearing the mask, but how are you going to protect yourself? Let's wear the mask. It's uncomfortable, but when you are in your room, you can take it off. It is a ministry, a call to promote health. How are you promoting health? How are you preventing others from getting infected? Even though you don't care about yourself, care about the other person besides you. So I think this is what I want to add. Thank you.
I think we have, Madam, you take it like that for us. Thank you. To add a bit to what the director said about the second question, wearing of masks is difficult. I agree. We don't dispute that fact. But Fantimon was say, Sazor tell the non-Gina Yahweh then. Those who don't understand Fante, when someone is chasing you and that person has not stopped her, you don't stop running home. You have to run until you die. So yes, we agree. The water is hot. Is that if you don't get the virus, you are okay. But the moment you get the virus, whether you die or you survive, only God knows. All those theories, the underlying condition, yes. Some people die, they have no underlying condition, they have died. You go to the primary schools, it's terrible. Children walking around. Is there a headmaster in this school? There are headmasters here. If not, there's somebody from the education here. Please, please, please. We agree, but not tie and the non-jinaya. I would know then on ye. Eat well. The on each other causes the baby alive. This is our local our dokonchinam anyo chichanyo bebregum ginger garlic, all those things. It will help you and exercise. And then vaccination, yes, it will come. I think the second question, the one of the answer to the second question is, and the third question, the vaccines will come. As I said earlier on, we beg you, if there are journalists here, please, and there are politicians here, please, onye bibia no there's politics. Because me, I can appreciate what the big man went through. I am in charge of that 400 people, and the heat that I felt. So when you are top there, everybody is now shouting at you. It's not that easy, and it's not that they are sleeping on the job. They are doing their best that they can. Okay? The vaccines were supposed to come. I remember India, people were dying to the extent that even wood to cremate them wasn't what? Enough. Do you remember that? And the vaccines were coming from India. So if my people are dying, will I give it to you? This is a vaccine. Also, if the Indians are dying, they won't give you the vaccine. So I think that is where maybe the break came from. So we beg, let the politics go down, and then let's all come together and help each other out of this. So yeah, the vaccine, they will come. The Russian one, I think they are roasting the minister in parliament for doing something that should not have been done. And the man says something, you will not feel it if you are not in the health system. At time they call for meeting in Cape Coast, the directors of health, medical directors. The demo to me zing. Yes, shame or ban and you also. So even we, the small directors, were panicking. How much more the big director? Things weren't that easy. We weren't in normal times. So let's be a bit compassionate to them. But the vaccine, they will come. Coming, they will come. And when they come, Your Grace, I'm sure you will take this charge and tell your flocks. Now there are things moving around. Have you seen those things? At the phone to her, no, then anybody who wants to crash his phone, bring it. We'll test it here. Or be a pedal crashing the phone off and break. I've taken 2 vaccines. I've taken 2 shots. Come and put your phone here and let's see. The conspiracy theorists in there are plenty, and I've been there since Adam. People don't like vaccination. It is there. But please, 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 for us to be sure, when the vaccination now, Minister Oba, then on Obi. Look at the European Union football that they had recently. A whole stadium full, no mask. Because everybody has got the 2 shots. And when they have the 2 shots, when the virus comes out, then they boom swine. But when you are not vaccinated and you walk, Max Nimueshu, continue praying. Thank you.
My dear people of God, I have to break my oath not to talk because this one, what's he say? Then actually fee sunasi no bakash or there. Then be the sunasi na nenyu akora. And kada miti nature ma koshe soil okora no nya no kwa. Usande easy actual mara me fee sunasi na merba. My dear people of God, I just want to support what Doctor has been saying. The reason why I have to always hold this thing and keep this thing down is strange enough. I begin to get almost asthmatic if I have it right when I'm talking on my nose. So pardon me. The first question people asked me was, Archbishop, how did you get this thing? Where did you get it from? Who gave it to you? And I said, look, how I got it, I can conjecture. But as to where I got it, who I got it from, is difficult. Why did I say I know how I may have gotten it? Because I have a bad habit of picking my nose, putting my finger inside my nose. Is something from childhood. I have a bad habit of holding my nose, always pulling my own nose. I also have a bad habit of rubbing my eyes because my eyes sometimes get dried and they itch and I rub my eyes, touching my face and the rest. So I think it's very possible either touching a table that had it, a door, or going somewhere. Because of my work as Archbishop, I had to go when you were called. It's possible I may have picked it somewhere on my hands. It's possible I did not wash my hands well, and I may have introduced it into my own system. The problem I had was, I think I was so robust that it took more than 2 weeks from when I may have contracted it to when it was discovered that it was bad. I was at a funeral and I started feeling chills after I had reported a week earlier that I would like to do a test. I had gone for a test. The people were not very conscientious. So about a week or 2 later, I was feeling chills, and I told my driver, Kweku, famiko fie. So I called a doctor friend in Accra, MDS Lancet, Dr. Paul Oponyantechi. And he said, Archbishop, come and let's do it for you, the test. So I went to MDS Lancet, and they did the test for me. I came back to Cape Coast, only for him to call me and say, Archbishop, will you be able to come back to Accra? And I said, well, if you want it, tomorrow, Sunday, I will drive back to Accra. He said, please come. I need to do a verification test. I said, so I went to Accra on the Sunday. That was the 31st of January. I got to Accra about 6:20. I just want to mention the fact that doctor was so conscientious at MDS Lancet. He had lined up the people who should do the MRI. He sent me in to do the MRI, and he said, Archbishop, wait and let's get a confirmation. Send the MRI report to South Africa, and they emailed back the results. And immediately he said, Archbishop, you must be hospitalized because you have a bad case. They tested my driver, who also had a case, but mild. So there I happened to know one of the benefactors of East Municipal Hospital. So I called the person who called Dr. Jackson, who called another person, and they said, Archbishop, come on Monday. So I got there Monday morning about 11 o'clock, and immediately they hospitalized me. My sons and my daughters, I walked into the hospital carrying my own luggage and the rest of it. They put me in a VIP room, maybe because I was Archbishop. But I'll be honest with you, for the first 5 days, until the video you people saw which went viral, which I took myself. I normally don't like selfies. But this time I decided to take a selfie in order to send the message around the world that this disease did not respect anybody. So I sent it out. After 5 days, going around, and the doctors were very hard-working and conscientious. It's a hospital that takes about 100 and something people. It was almost full at the time. I will stand here and I will say it, put it on record. The doctors were excellent. The nurses were conscientious. The ordinary workers, the orderlies, those who were even cleaning my room and everything, they were there conscientious. 4 o'clock in the morning, they come and clean. 5 o'clock, the doctors and the nurses come. 10 o'clock, they come. 11. Maybe because I was who I was. But I'll tell you, they were so good. They were so very good. I was giving medication, I was giving everything, I was giving the support and so on. I was there for 17 days. After I sent my video, I can tell you that I started degenerating very badly, in spite of all the care that they were taking, that I couldn't walk from here to there without support. It's a horrible sickness. And in the night, I had to change about 4 pajama suits because even in an air-conditioned room, you'll be sweating. I decided not to use the air conditioner because I was afraid of pneumonia, which is supposed to be one of the vectors of this thing, you know. But I just want to say that the doctors were conscientious, the nurses were conscientious, the orderlies were conscientious, the food that I was giving there and the rest of it, those who took care of, they were just, you know. So gradually, from about the 7th, 8th day when I went down, I started gradually getting up. Luckily, I did not need the ventilator, but I needed oxygen, you know, from time to time and the rest. And if I want to describe how horrible it was to you, you know, it's just to tell you, please stay away from the sickness. That's a sheer fact. So I was there for 17 days until I was asked to go home because they had tested me and I was now negative. But even the post-hospitalization care was more difficult. What I did, my driver tried to do for me, was to do steam inhalation. I will recommend it to you because apparently it helps to breathe a bit better because it eases your lungs from all the mucus and the rest of it. Just steam inhalation 3 times a day, morning, noon, and night, before going to bed. And I remember the first time I got in touch with something called abonike. My God, I never knew that there was a certain, what you call it, ointment like that. When they put me through, doctor, I almost felt like I was melting my whole body. Anyway, let me cut a long story short. It took me 6 extra weeks because I had what they called a very severe case of the virus. It took me 6 extra weeks, apart from the 17 days, to get well. I was told when I was getting out of the hospital to come, I was coming to Cape Coast, that my Archbishop, don't forget, you are 70 and over. You are no more young. Don't go jumping around the place like that as you used to do. You've got to be very careful of yourself. So what doctor is saying, and our chairperson is saying, my sons and my daughters, well, as our chair, if you soon say, now Baba catch all day, then chambi dasi ho manum, or numebua, manka de aids in nature, na kosha the one numebua, will soon say more ye, a chawala. So every parish I've been to, I have told them to be careful. And I joined doctor to say the same. But I must also say thank you, because as doctor is saying, they themselves run a lot of risk. They are exposed to us who have had it. And because of that, since I left the hospital, every day to my rosary, I add 1 decade of prayer for doctors, nurses, their families, and also for patients. I will therefore tell you, we are at a synod, and one of the things we do at this synod is to pray. Doctor is asking us, priests and religious church elders, and let us do our bit, because the Pope says, as long as one person still has the virus, the world is not safe. As long as 1 out of 7 billion has the virus, the world is not safe. That is why he is pleading they must make the vaccines available even to poor people and the rest of it, so that as many of us are vaccinated as possible. And please, take it from us. Take the vaccine. There is no alternative to it now. Take the vaccine. And if, in quotes, for all the conspiracy theory, if the vaccine is going to kill you, at least you know what killed you. You understand? It is good to know what killed you than not to know what killed you. But I doubt if the vaccine will in any way at all kill you. So, doctor, on behalf of my people, I'd like to say sincerely thank you to you, and thank you to Madam Sophia Blankson for the work you are doing. We owe it to them to ask God to protect them and to ask God to protect us all. As for the answer to why, where, when, what, the protocols are the answer. Thank you very much.
Thank you very much, Your Grace. I know people had questions, but we don't have time for it now. Please write your questions and give them to the secretaries. But let me add this small teaser. We have Veronica buckets at every entrance of this hall. This afternoon, when we were coming for this session, how many of you washed your hands? There this morning and checked how many used paper napkins were in the bins, and this afternoon I've checked again. I thought, we are not paying attention to the protocols. So please, let's remind ourselves and keep ourselves safe. I think doctor has said that the only medication is to prevent yourself from getting it. Now, let me call upon Father Joseph Eshenbenya to come and give us the topics for the group discussions. It is already time for it.
Your Grace, Mama Chair,
Doctor, my brothers and sisters in Christ, good afternoon to you all. This is time for our group discussion. We have had 3 talks now, and we have done one discussion on one of them. That is the talk from Sister Benedicta Mante, baptized and saint are called to holiness. We have had discussion on that. This discussion is going to be on the second talk, on the topic, baptized and saint are called to promote effective care for marriage and family life. We have had this from Dr. John Boachi just before we had our lunch. And this is what we're going to have our discussion on. So the group leaders, please do come forward for the questions. The first question is, in what ways can the church promote growth of marriage and family? In what ways can the church promote growth of marriage and family? So group 2, Mr. Augustine Hagan, and group 7, Dr. Alice J. Wilson. Please come forward for the questions for your group. Question number 2 is, in what ways can your family promote the gospel? In what ways can your family promote the gospel? Group 1, Mr. Augustus Amos Amwa, and group 5, Mrs. Doris Ishen. Please do come forward for your. Question number 3, what are the challenges of the family today? What are the challenges of the family today? And this goes for groups 6 and 9. So group 6, Dr. Joseph Akun, and group 9, Mr. Emmanuel Ajiman Prempe. Question number 4. How can we promote a healthy Catholic family? How can we promote a healthy Catholic family? And this is for groups 3 and 8 to discuss. So group 4, Mr. Francis Ekushia and Mr. John Edu. Question number 5. Why
Hello, in Jesus Christ. Please, your attention for a minute. I'd just like you to know that we have been streaming sessions live on Facebook and then on YouTube. You can access the videos at any time. That's what I want you to know. Because the videos would always be available and then for you to access. So you can write the address down own convenience. When you want to play back any of the talks or any of the videos, you can do so. So for Facebook, you need to go to Cavdel Cape Coast. Cavdel, C-A-F-D-I-L, Cavdel Cape Coast. And then you can access any of the videos that we have made from day one to, and we are going to continue till the very end of this program. When you go to YouTube, the address is Cavdel Edu. Edu is education, so it's EDU. It's been shortened, so Cavdel EDU. There you will be able to access all the presentations that have been made, and you can play them back. You can send them to your friends and family, and you can share them on different platforms as well. Whilst you are on any of these pages, you can also like the page, subscribe, so that whenever we go live, you would be notified, and then you can also follow the proceedings there. Thank you. If you have any questions, you can always see me. Thank you.
A quick one. Please, you are coming back in 45 minutes' time for reporting before we go for supper.